Well, joining us on the set now is Dr. Aidan Raney. He is the surgical director for the Hoag Heart Valve Center. Nice to meet you. Good morning.
Good morning.
You have quite a few titles, actually.
I do. I have a number of hats that I wear over at Hoag Hospital.
How long have you been with Hoag?
I've been there, actually today is our 25th anniversary.
Well, congratulations. Good job. Hoag's a beautiful hospital. We want to talk especially today about heart disease. With our aging population, we have something like 80 million boomers coming on our population now. Heart disease, I imagine, is a very important topic.
Yes. Well, in terms of the heart, there's three major conditions that affect the heart. One is coronary artery disease. We're all aware of that. That causes obstructions, and they can be treated with medicine or stents or surgery. The second main problem or condition that affects the heart is heart disease of the muscle itself. That's much less common, and that often is treated medically and occasionally with transplantation. But the reason that we're here today is to really talk about heart valve disease. So the heart has 4 chambers, and it has inlet and outlet valves for each chamber. So the heart has 4 valves. 2 of those valves are the ones that we deal with predominantly, and those are the aortic valve and the mitral valve. The newest big advance in treatment of valvular heart disease today is the release of the device that allows an aortic valve to be implanted into the aortic position without open heart surgery. Wow. Now we have a little, for the audience, we have a little cartoon. If we could show this.
This actually shows basically how this procedure works, and
Right.
it's interesting because when you talk about heart disease, the heart valve disease though is a genetic condition, or is
It
that a
can be
lifestyle?
genetic,
Can
it
be?
can
Can
be
be both?
genetic and somewhat lifestyle, but mostly this is not something that activity and so forth will affect.
Okay.
Will this clip show again? Here's an actual deployment of the valve. You can see there's the heart valve there, and a catheter will be inserted, and then that valve will be dilated up. Now what's unique about this, there you see the valve is being implanted, and so what it does is it treats aortic valve disease only, and it only treats obstructed aortic valves. So the device is inserted, and then a balloon deploys that device and seats the valve in the annulus, or the ring where the valve should sit. The advantage of this technique is that it's inserted through a catheter up into the heart, does not require an open heart surgery, conventional surgery, does not require the use of a heart-lung machine, and the patients are in the hospital for a much shorter period of time.
Now this is, I believe, a stainless steel.
So this is a device here just to show you, yes, this is a catheter that first of all dilates the valve. And the heart is paced, so the heart isn't beating during this portion of the procedure. So now the sheath is inserted, and the catheter then goes up the aorta, curves around, back into the heart.
Wow. And then once it's placed, you just
the valve is
blow it up?
delivered, and then a balloon is the heart is paced. So now right at this junction, the heart is just beating very fast so that it doesn't move, and the valve is deployed in the exact correct position that it should be.
Wow.
And you can see here the next segment here of the film will show the valve.
Now, what will happen with the natural valve that was there? Has that already been displaced, or is this just kind of sits on top of it?
So that's the normal, that's the valve functioning. So who's a candidate for this? This is new technology. It's a new device. We only have about a 3 to 5 year track record in terms of the utilization of this valve. And the questions you ask are very good questions, and that is, what happens to the valve? When we do a conventional aortic valve replacement, we remove all of the diseased valve, all the calcification, all the fibrosis, and then we insert the new valve into a clean segment or annulus of the heart. In this technology, the heart valve is intact. All we're doing is blowing a balloon up and separating the cusp of the valve, or the leaflets of the valve, and then inserting a new valve inside. So consequently, because it is a new device, it's new technology, it's not a perfect solution. It is reserved at this point for patients who are considered too old or too high risk or have too many other medical problems, or maybe they've had 1 or 2 prior heart surgeries, that makes it very, very prohibitive to do a conventional procedure. This would then be applicable to that patient or to that population of patients.
Right. So at that point, the person would then obviously talk to their general practitioner and then be recommended to a specialist like yourself, mostly for people with inoperable heart conditions.
Yes.
Would be candidates for a product like this.
If, for example, I saw a patient just yesterday who was told by her physician that she was really not a candidate for conventional surgery. And so she was never referred to a surgeon and was never referred on for any discussion. Now that this device is available, and Hoag is fortunate to be the only hospital in Orange County to receive this, and there's only about 7 in the state of California that are now implanting this device. But as a consequence of that, she is considered now a potential candidate for this. So now she was referred, and a lot of times it's the patient themselves or their family members that call us and say, is my mother or father or my brother or sister, or am I a candidate for this new technology?
Now, when people are first experiencing heart problems and they are specifically having heart valve disease problems, is it the same kind of condition that people feel when they're having a heart attack, or the shortness of breath and things of that nature?
Well, generally when somebody's having a heart attack, the most common symptom is chest pain. In this situation, the most common symptoms that patients complain about are increased fatigability, shortness of breath, lack of exercise tolerance. Also, they can develop chest pain because of the fact that these valves, the aortic valve, has become so calcified and so obstructive that not enough blood is coming out of the heart to feed the arteries, and it sort of simulates a coronary artery problem. And the other one is dizziness and or just flagrant passing out.
Right.
So those are the sort of the spectrum of things that we see that are indicative of potential valve problems.
So I would imagine candidates for this procedure, their average age is probably in the early to mid 70s?
Yes, we operate on a lot of people in their 70s and 80s as well as the 90s. So by the fact that you are 70 or 80 or 90 doesn't exclude you as a surgery for the candidate for surgery, which is the gold standard and still is. On the other hand, most of these patients are in their 80s or 90s, and they have multiple other medical issues. So they may have severe renal disease, kidney disease. They may have severe lung disease. They may have had multiple operations. They may have certain types of other medical conditions, such as a history of severe anemia. Those are the things that would shift them over towards consideration for this procedure.
And again, they would need to work through their insurance carriers to get to your location?
Well, this has been, all they have to do is pick up the phone, and we will take care of all of the questions that they may have in terms of insurance and all those things.
Very good.
So,
sounds very interesting. Obviously a new treatment, so we'll see.
New and exciting.
Yeah. How long has this been on the market then? For only a little while then?
it's been done, as I said, it's been done in Europe predominantly for maybe 4 to 5 years.
Okay.
It came to the U.S. in trial centers, I think about 2 years ago, and now it was just released to commercially just to selected centers, as I had mentioned. So it's only been in the last few months that we started the program.
Well, it just tells you how fortunate we are to not only live in our area in South Orange County, but to have a wonderful hospital like Hoag Hospital, who has this facility and this ability to help people, especially if you're suffering from heart valve disease. So, Doctor, thanks so much for joining us on the program
You're
today.
welcome.
Very important information for especially our audience and for any of those who have loved ones that possibly might be suffering from heart valve disease. Thanks so much for joining us.
Thank you.
Again, that's Dr. Aidan Raney. He is the surgical director with Hoag Heart Valve Center. Give them a call at 888-689-4179. Or I encourage you to definitely go to their website at hoag.org, and you can also get a lot of different information. Or just Google Hoag, and you will get a lot of terrific videos and information that would help you get you through some of these processes. We'll be back with more of the Channel 6 News Hour right after this.
Orange County has a brand new hospital, one with nearly 60 years of experience. Hoag Hospital Irvine offers a wide range of inpatient and outpatient services, including 24/7 emergency care. Centrally located at Sand Canyon and Alton Parkway, just off the 405. Hoag Hospital Irvine, caring for the community.